Well, this little mama, you can see she's a mama. She's been nursing for 3 weeks. And she's kind of panting, shaking, and fell over. She actually kind of went into a spasm and fell over. 3 weeks after giving birth, with all that milk, you can see she's produced, and she's just a little faint. She can have eclampsia. We're going to check her calcium levels and see if they're the reason why she's shaking. So if you can see probably best in her back legs. See how they're twitching? See that? So we'll see what the blood results show. We're going to put a catheter in her. We're going to get some blood tests to see if her calcium's low, and then we're going to give her some calcium and IV fluids to see if we can make her feel better. We're going to start giving the calcium. It's about 5 cc's over 20 minutes, and you can see he's just having a hard time. Of course, anybody would have a hard time standing if you were up on one leg and going into spasms. Sorry. So this is calcium gluconate, and we're gonna see how we're gonna check the level of calcium. But before we found out exactly the level, because the clinical signs are so suggestive of a calcium deficiency or hypocalcemia, I went ahead and gave a little calcium now. We gotta give it slowly, because if you give it too fast, it can stop the heart, and that's not a good thing. So here's our little mama's blood work, and we can see most things are in the normal range. There's some borderline highs and lows, which aren't significant. The kidney enzyme's up a little bit, probably just from stress. The calcium is low, like we thought, because she's nursing your puppy so much that she's got low calcium, and all of her organ values are good. So that means that the calcium we're giving her should really help out. Starting to feel more comfortable. She's still panting, but we're giving the calcium slowly over 5 minutes. And if you can see, she's not panting near as much. She's still a little, well, I said that she is, but when you open up the cage, she's happy. Well, when you open up the cage, she comes right to the cage. She's not shaking or tremoring near as much. She's not panting. However, she's breathing a little hard. Let's see if she, whoops, I'm sorry, sweetie. Come here. So you can see she's walking around much more animated. She can move around. She's not stiff and spasming like it was before, shaking. She's acting like more of a normal dog. All right, that's good, sweetie. You can go home to your puppy soon. You probably wish that. You probably like your vacation, huh? You like your vacation here at the clinic? I would. You're a good girl. You're a good girl. So we'll give her we're going to have the owner get supplement her with calcium twice a day at home, and probably wean the puppies so that she doesn't get depleted of her calcium. So you can see mom's not shaking near as much. She's acting a lot more normal. In fact, Robbie, could you get some baby food for this little one?
I sure will.
What you eat, you eat. Are you going to eat? I'm sorry, she's a patient. That's very inappropriate. We're going to get her some chicken baby food, and I'm going to give her a shot of we can't give this calcium. We can give the calcium IV, and you can't give it under the skin unless you dilute it. So I'm going to, I've diluted it with saline, and we're going to give it, I'm just going to see if she eats. Because when you eat, that means you can get more of that calcium in your system. Yeah. Oh, you like baby food. So that's good. So if she's eating and swallowing, that's a good test, because And she can eat the rest of the jar too, which is
Here.
when she can eat the rest of the jar because she's got
She can use the
babies
groceries.
delays. So I'll give her a shot while you're doing that. This is calcium, which we're gonna give under the skin, and you can see even that big old volume of fluid didn't sting and it didn't cause her any discomfort. Of course, when you're busy eating very ferociously, then nothing bothers you. So she's going to go home this afternoon on some calcium supplements. Bear with me, I'm a little ill today. I have an upper respiratory infection. That's what we call it in cats. I have a cough or a cold so if my voice is a little gravelly, it's because of that. Anyway, calcium deficiency or eclampsia in dogs can occur after 1 to 5 weeks of nursing. Usually it's not that they're that low in calcium, it's just that they can't get calcium from the body to the milk without lowering it in the blood. And if you have low calcium in the blood, your muscles don't work very well, and your heart's a muscle, so all that gets to be really bad if you have low calcium. Most times, if given enough food, most nursing mothers won't develop this. But young dogs and small dogs sometimes will develop this, as well as dogs with great big litters. Um, some easy sources of calcium are raw bones. Just chewing on a raw bone, even though most people hate that. I feed my dogs raw chicken wings. It gives calcium, phosphorus, and joint chondroitin, glucosamine chondroitin for the joints. It's a really good source of calcium. Cottage cheese is a good source of calcium. And also you can get balanced vitamin mineral supplements for nursing mothers can help. You don't want to give it just all during pregnancy because it may depress the amount of calcium brought in. It's always best not to over supplement. Some supplementation is good when an animal's performing or stressed or has a medical problem, but just over the counter, just a generalized supplementation, probably over supplementation isn't always a good thing. Anyway, so this little dog is going to go home on. First of all, we're going to wean her puppies so she doesn't have the drain of calcium, and then we're going to give her calcium tablets or cottage cheese. I gave the owners various things they could do in order to keep her calcium up. So we're going to decrease the amount of calcium that goes out in the nursing puppies, or we're going to feed her more calcium in the diet with just over-the-counter calcium tablets you can get at the pharmacy, or there's another really good product called Calbsorb you can get at your feed store or your veterinarian or pet store, and that can help raise the calcium. Dogs with eclampsia can really get sick because if this calcium goes lower and lower and they get more and more spasms, their temperature can spike, so they can become almost seizure-like and overheated at the same time. But I hope you saw the twitches in this little one. That's what I really wanted to show you. And sorry, my voice wasn't perfect and my demeanor was maybe a little bit less engaging because I was a little ill during this video. Anyway, but I thought you'd really enjoy it. Thanks for watching, and if you had a chance, go to my website, Dog Dish Diet. If your dog has ear problems or skin problems or dry skin or is obese, it's important to really think about the ingredients you're feeding. And maybe even want to home cook for your pet. So I have a book out called Feed Your Pet to Avoid the Vet and a book called Dog Dish Diet. And if you read both of them, it'll give you some feeding ideas for dogs and for cats. Have a great day.